Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about what you should tell your physical therapist. Now, if you have a physical therapist and you're listening to this podcast, you have been listening to this podcast, and you want them to understand what might be most helpful for you in your situation, this is the podcast that I want you to send them to. We're also going to talk about our virtual coaching and why that can be so helpful for people, even though we never lay a hand or actually provide physical treatment to anyone that we work with. Those two concepts are going to blend together and be super helpful for you helping your provider you're working with understand what they need to do to help you. So, any physical therapist, it doesn't matter who you see, is trained and understands how to restore and resolve movement problems. When we talk about dysfunction and the body not moving as it normally should, there's a discrepancy in what efficient, normal movement looks like, and there's compensations that happen. There's added stress to the body. There's added stress to joints, ligaments, tendons, muscles. That ultimately leads to pain, irritation, inflammation, causing your symptoms, whatever you experience as far as your headache or your migraine. Okay, so this is a neck problem, this is a shoulder problem, this is a jaw issue. Now, it's not totally uncommon to find physical therapists that are comfortable working on the jaw, and most physical therapists should be comfortable restoring shoulder issues, restoring proper function of the shoulders. The neck is a little bit more of physical therapists are less comfortable, at least less confident stepping into the neck zone. But this podcast should be helpful in laying out a framework, not necessarily the specifics. We're not getting into the nitty-gritty of what we actually do as far as the techniques, or this isn't intended to coach a physical therapist on what specifically like a mobilization to the upper part of the neck should look like. That technical side of things is not going to be as helpful for you, the listener. So the podcast is designed for you, the listener, to consume this information, both be helpful for yourself and also be helpful to pass along to the physical therapist. Okay, so the first is a concept that I want to talk about. The first thing I want to talk about is just a broad concept. And I think when we understand that, so when people are dealing with headaches and migraines, they're sort of wandering through our healthcare system, and they don't necessarily interact with too many people that have confidence in the sense of they understand their symptoms, they feel heard, and they're talking to someone who says like, yes, I can help you, and here's the plan that we're going to put in place. It's a lot of, I don't know what exactly is causing this, but let's try this medication, let's try that medication. And hopefully there's some symptom relief, okay? So what I want to tell you first off is that you can help, all right? So the confidence that a provider has, or the lack of confidence, I should say, is one of the biggest barriers in our healthcare system for patients finding relief. Working with a provider that is not confident that they can help you is ultimately not going to lead to a good result. Now, it's cyclical, right? So the reason the provider is not confident is because they don't truly know what's happening or how to help. And so that lack of confidence, the lack of understanding, means that they're not equipped. If they were equipped, they'd be more confident and be able to step into this and say, hey, I can help you. So that the result of that is that the patient having working with a provider that is confident will then have a sense of belief that the plan of care that's being laid out will work, okay, resulting in improved outcomes. So this is sort of like a psychology of health and healing, but there's all sorts of things on the market, and the perception that we have in our mind of that thing and how effective it's going to be for us is in itself, it's a self-fulfilling prophecy, right? So if we believe the thing's going to work, it's likely to work, right? So the placebo effect, it's used in all sorts of settings. I'm not just talking about like a woo-woo bracelet you bought that's curing all your diseases. We even see this in certain types of surgeries where, you know, they perform the surgery in one and the other they don't, and both people feel like they're improved. So anatomically, nothing changed in the one, but they feel the benefit of it. So if you perceive that you're being helped, your brain is likely to experience the relief that you're looking for. Okay, I'm not saying that that's wrong or it's bad. It's in everything. It's just how our brains function. It's how our bodies function, and it's not as if utilizing that is an issue. Now, of course, we want to actually. We don't just want to make stuff up. Like, we want to understand the problem. We want to provide a real solution to that problem. But the confidence behind it is a big piece of that. All right. So just know as a provider that you can help. Okay. A physical therapist can help. So the other thing is we assume as providers, as physical therapists, this headache migraine category of symptoms is sort of it's just out of touch. It's out of reach. It's not something that we're trained in. We don't have a robust amount of training in. So we maybe have like the neuroanatomy and the biomechanics and understanding pain and pain science. But when it comes to specifically headaches and then migraines, like that's kind of scary. That's these symptoms of nausea, vomiting, light sensitivity, and debilitating, one-sided, throbbing, pounding sensation. Those are things that physical therapists feel like, I don't know if this is my wheelhouse, and will then send the patient out to neurology, maybe feel like it's appropriate for more imaging. And then you're down the road of assuming like medication needs to be on board, a neurologist needs to be on board. Now, both medication and a neurologist can actually have negative side effects, I guess, to them. So medication has natural side effects. Medication can lead to rebound headaches. So medication itself we see as a barrier, especially medication that's taken regularly, whether that's preventative or abortive. And the medication is masking your symptoms. It's changing how your body responds at the chemical level to the pain that you're having. And so as a physical therapist, trying to understand how this is impacting your body, sending someone down the road of medication because we don't feel comfortable, isn't necessarily helping them. Now, a short-term symptom management medication can definitely have some benefit, but ultimately we as providers want to understand the problem and then start helping this person solve it outside of meds, because when we don't, if you're a provider and you don't understand what's actually causing their symptoms, I can understand you want to help them, and medication is a tool that can help symptom management. But ultimately, we don't want to stop there. You want to understand why, and medication isn't solving the why, okay? It would be, on rare occasions, is medication really ever solving the why behind something. It's really just sort of artificially interacting with the environment, changing it, so that symptoms go away, okay? Or at least are reduced in frequency or intensity. And then the neurologist as well. So again, like neurologists will likely go through the appropriate screens to make sure there's nothing that is more serious, more severe that's happening. That can be very appropriate, especially for a lot of people that have like a quick onset or new symptoms or things that, this can all feel scary. So oftentimes it is appropriate to go through the MRI, the CT, those things. But the majority of people are that's not going to come back with any sort of result or explanation. Sometimes it even leads to things that are found that have nothing to do with the headache or the migraine, and really don't need to be considered as a problem. But because it's something abnormal, they sort of latch onto that and pursue it. But that's a little bit of a tangent. So the neurology world, the neurologist in all their training, and it seems kind of interesting to think, someone has so much training, but they really don't. They're not trained in looking at headaches and migraines through this lens. And so they're not trained in thinking that a migraine is coming from the neck. I would say understanding that migraines come with neck pain, they would say yes. Understanding that migraines, maybe they'd say would cause neck pain, or that neck pain's associated with the migraine. But I think it'd be challenging to find a neurologist that says, yeah, the migraine symptoms are caused from the neck. Okay, that's not something that they're trained or would even understand. And so going through the neurology route again is sort of like taking a step further away from the underlying source of these symptoms. Okay, and so medication, neurology, when the physical therapist isn't confident, that being their route. Again, it's all kind of cyclical. So they're not confident. They send you out. You go to a neurologist. You try the medication, and you feel like you're on this hamster wheel of like, no one knows what I'm dealing with, and I feel hopeless. And the symptoms are just sort of like kind of managed with the medication. Sometimes they don't even touch it. And so we need to break that cycle. We need to have confidence that we can help these people. And I'll get into what that actually looks like. The third thing in this category, and just speaking to the fact that we can help, so the symptoms of like dizziness, brain fog, light and sound sensitivity, nausea, these are things that, again, can feel intimidating to a physical therapist to try to help. We're used to working with like low back pain, knee pain, that type of stuff. Like we got that. These other things we start getting into, and we're sort of trained to be fearful of them, and like alarm bells start going off. And so what we need to do is focus on what it means to be healthy. Okay, so instead of looking at this individual and thinking like alarm bells are going off, these are yellow flags for something, I need to have this screening done. Most of the people that we see here at Novera have already been through our healthcare system screened, and these are chronic conditions. These are things that have been going on for years or decades. So there's nothing acutely that needs to, be alarming to us. And so what we need to do is change our mindset and start thinking about what is healthy. Okay, pursue what is healthy for this individual. All right, and if we sort of are able to step back and say, okay, like I am going to help this person. I am going to be the one that steps in and starts to help this person on a journey to improve their health. Then I think just about any physical therapist is equipped to understand how, like, at least I would say several things as far as helping the physical body and movement and restoring function that most people will benefit from with headaches and migraines. Okay. So before we jump into like lifestyle and our virtual coaching and how that's applicable to this scenario, the hands-on treatment, I'll speak to that for just a little bit here. So we are a pretty heavy manual therapy practice. And what we found with headaches and migraines is that most physical therapists will not spend nearly as much time as we do applying specific pressures to specific spots in the upper part of the neck. Okay. And so the amount of pressure that needs to be applied to, let's say, like the atlas to get it moving. Let's say we want to restore nodding motion. That nodding motion has likely, the head sitting on the first bone, the head sitting on the atlas, has likely not been moving for years or decades. So if someone says their migraine started 10 years ago, you can assume that their neck problem predates that. So it might be a year or so even before their headache started. And so what we have to understand is that the tissue is adaptively shortening, right? So it's not moving. The ligaments, the tendons, it adapts to the lack of movement, and it shortens, right? And so we have a joint that hasn't really moved in a long time, and it's sort of retaught itself to just not move. Okay, so if we take someone's neck and we put a little pressure through certain spots and we say, okay, like this is really sensitive, the muscle on this side has a trigger point and that's really irritating, that's fine. And we can do traction, we can do a little gentle massage, we can go through range of motion. But if we don't specifically address mobility through the specific joints in the neck, that person is going to miss, you're going to miss a huge amount of potential for them to find the relief they're looking for. those specific joints not functioning the way they should put stress on the mid portion of the neck. It increases or changes resting posture. It causes the shoulders to have to get involved. So different shoulder muscles have to sort of act like guy wires on the neck and help hold the neck up. And so there's all these things that start to unravel when we're able to apply specific and probably a larger amount of pressure than you would think to these segments, because these are ligaments, these are tissues that over time have learned not to move. And so we need to be specific and apply enough force so that they start to move again. Now, if you have no idea or have never worked on the neck before, do not take this podcast and say, well, I'm just going to start doing this, because I would suggest working with someone that's familiar with the mobilizations to the upper part of the neck. That may be challenging to find. Ultimately, reach out to us if you're a physical therapist, and we can start the conversation of helping you understand what needs to happen for the person in front of you with headaches or migraines. Now, that's not to say that all the other things in your arsenal of tools to use are not going to be helpful. So whether it's restoring function of the shoulders, whether it's all the other manual techniques for the body, those can all be super helpful. So the listener here, understanding that physical therapy we have a tool belt with all these different things that we can utilize to help someone. There are certain things that we find to be a direct impact and a greater impact on someone's situation that has headaches or migraines. But in general, like, there's lots of different things that can help people, and a lot of them aren't necessarily specific to us. But we do see that we've sent people all over the country trying to find someone in person that can kind of replicate or get close to what we do, and that's been challenging to find. But when we zoom out and say, like, are there other just generally helpful things that physical therapists are able to do? Yes, absolutely. Okay, so to summarize that section of the hands-on, if we're getting into the neck and going to apply hands-on treatment, we need to be specific and understand that there's a level of pressure that needs to be applied to actually restore mobility to the joints. But that doesn't mean that that's the only thing that needs to be done. And yeah, definitely feel free to use kind of the whole arsenal of what you have available to you. Okay, and then if we zoom out even further, let's talk about our virtual coaching and how we're able to really just communicate to someone, motivate someone, coach someone on how they can help themselves, and they find the relief through that. So just recently had someone virtually that had seen, neurology, chiropractic, other physical therapists, had tried all sorts of medications, Botox. So basically the story is, had tried everything that you can try. And then we did 4 visits together virtually, coaching them on what they should do, and they found the relief that they'd been looking for. So never touched them, didn't even necessarily like evaluate or provide diagnosis, nothing like that. It was just, you have a neck, let's talk about what your life should look like to take care of your neck, okay? And this is why I think you as a physical therapist, so if someone passed this podcast on to you, if you're someone with headaches or migraines listening to this, understand that the details of what needs to happen, there's an element of that's in it, okay? So it's not as if like just getting someone to walk more is the secret sauce. But I guess my point is that the secret sauce isn't like super secret, okay? Oftentimes what we coach people through is this formula, and it's a formula that says, okay, you're in a posture, position, a type of movement throughout your day, okay? You're either sitting, you're standing, you're walking, you're running, you're working out. So you're doing something like that. Sleeping, I'll throw into there as well. So 24 hours a day. So your body is either increasing the amount of stress it has through it. It's either a net neutral, where whatever activity you're doing isn't like increasing or decreasing stress, or it's decreasing the amount of stress, and it's therapeutic. And so what we want to do is understand what your day looks like. And then we want to take the things that are negatives and increasing the amount of stress, and we want to put them in either the neutral category or the therapeutic category. And so if we can take things and start putting them in the positive bucket, in the bucket of this is therapeutic for you now, then we get out of this cycle of someone feeling stuck and they can't understand their triggers and they can't understand why their headache pops up when it pops up. And so they have all these different questions that are in their mind. And what we ultimately need to pursue is just what is healthier? What does life need to look like physically on our bodies to reduce the amount of stress that we have? And so take, for example, someone that wants to lose weight. If someone wants to lose weight and you're a health coach or you're a dietitian, now we may not make the specific goal of like, you're going to lose 10 pounds in 10 days. That might be pretty challenging. I don't know, like if you have the motivated patient who does exactly everything and you've done this enough, like maybe that's a goal you make. But if you don't feel confident that someone's going to lose 10 pounds in 10 days, that doesn't mean that you have to question your product or question your recommendations to that person. Because there's so many different dynamics that each person has that will change the rate at which they lose weight. So that person's compliance with what you tell them, that person's health otherwise, so their general health, their mental stress and anxiety that might come along with it. So there's so many factors that go into this that it's hard to say, like, again, in 10 days, you'll lose 10 pounds. But that doesn't cause us to question the product itself. So as that dietitian, you would still have confidence in like, hey, if we reduce your caloric intake, increase your caloric output, and change the foods you're eating to more whole foods, healthier foods, more vegetables, more fruits, we reduce the amount of sugar intake, those things are healthy, and that's not something that needs to be questioned. And so as a provider or as someone listening to this podcast, you can move forward with confidence that exercise and movement and mobility and taking these things that are negatives and putting them in the positive bucket are things that are going to help you. And we see that over and over again virtually. So when we help coach people through these processes, they start to get the results they need. And so what's profound about this is someone can go through our healthcare system, see the latest and greatest provider that has access to all of the new medications and go through the whole healthcare system and not find the relief they're looking for. Yet we can coach someone and just in that framework, and they can find the relief they're looking for. It's pretty incredible. So as a physical therapist or as someone that is listening to this, trying to help someone with headaches and migraines, know that I would question, and if you're listening to this and you have headaches and migraines, I would look at your day, understand what positions, postures, movements you're providing on your neck and shoulders throughout the day, and think, how can we infuse movement? All right. In our virtual coaching, we also lay out more of a focused, like here's some things to do in the morning, here's some things to do in the evening. And there's a few other things involved, but for the most part, like those are the keys to success. And I think the intent of this podcast is to encourage the listener to start taking action and say, okay, like even if I can't come to Novera, even if I can't find someone to exactly do what I'm doing, I can start making changes in my own life. And then also to the provider, if someone told you to listen to this podcast, know that the pursuit of healthiness when it comes to movement, getting someone moving better and zooming out and looking at lifestyle and not overlooking that can be hugely impactful and hugely important. And any physical therapist should feel comfortable and confident stepping into that. Okay. So just to recap, you can help because you are going to stick to the things that you know are going to be helpful. Again, it's the diet and the, let's reduce your calories. Let's eat more salad. Those things are good. And when we think of the physical side of that, help the person pursue physical health and well-being. We're going to look to be, if you're comfortable with the hands-on techniques, we want to be specific and we want to understand that the neck needs potentially a certain amount of pressure, of force to really restore function and mobility to the upper part of the neck that oftentimes physical therapists are shy away from or aren't confident in. And again, my qualification with that is if that's not permission to just jump into it if you have no experience at all. It means find training so that you can get the confidence to provide those techniques that are needed to be done. And then thirdly, don't overlook lifestyle. Just understand that someone's general lifestyle and putting those things that are in the negative bucket into the positive bucket, making their life therapeutic kind of at every step of the process is something that has worked for us very well. If you are someone listening to this that has headaches or migraines, maybe you can't come in person to see us, you're out of state, please reach out to us because we would love to have you go through our virtual coaching so that we can help you find the relief you're looking for. We can also help guide you in what maybe a provider near your area looks like, whether that's a physical therapist or someone else. And then please pass this along to a physical therapist. And if you're a physical therapist looking to learn more, reach out to us and we'd love to help out. Thank you all so much for listening to the Headache Doctor podcast. As always on this podcast, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.